For this next session of the Covering Rare Diseases Fellowship Program, we're going to explore the role of genetic counseling and how having access to it is the key to empowering families and patients. We're joined by Barbara Biesecker, who is the Distinguished Fellow in the Genomics, Bioinformatics and Translation Center with RTI International. Thank you so much for joining us today.
It's my pleasure. I get to talk about my favorite subject, genetic counseling.
Why don't we start by you giving us a background on your professional career and your journey towards specializing in genomics?
Well, it was a long journey. I've been a genetic counselor for 41 years, mostly in academic settings. I started out in pediatrics, serving rural communities in Eastern Kentucky. There was some state funding there. And at that point in time, we drove around to people's homes and to remote areas to help families, but it was often very difficult to even diagnose what their children had. And certainly we were years and years away from understanding the genetic origins or the treatment. So it really depended completely on the counseling aspect of genetic counseling because there wasn't much we had to tell people at that time. And then through the years, I worked in internal medicine, I worked in cancer genetics, and I have been involved in the 3 different training programs over the years, the University of Madison and University of Michigan. And I helped to co-lead and start the genetic counseling program at the NIH and Johns Hopkins. And I still supervise students in that program, even though I've retired from the NIH. So long history, a robust and interesting career that changed, I think, who I am and how I think about the world.
Our speaker directly ahead of you, journalist Richard Engel of NBC News, shared some powerful stories of his journey with his son who passed away a few months ago. But what it has me, and I'm sure all of the journalists thinking about, is access to information, that being the key for parents who are going through this, who are trying to find resources for their children, et cetera. So why don't I turn it over to you and you walk us through that role that genetic counseling plays in this journey?
So genetic counselors are very familiar with rare disease and resources that are available, but they're not available for all rare diseases. And it's particularly difficult when there's no diagnosis. So there's no certainty about what the condition is. There's just description of symptoms, and that makes it much harder. As a result of that, there are places like the Orphan Disease Network for diseases that are unnamed but rare. There are a lot of genetic support groups for those diseases that are diagnosed and found, and families often start their own organizations when there's not something that they can go to about their disease. There's even a couple of stories of parents who have funded and worked toward trying to help identify the gene or genes that is responsible for their child's illness because they're scientists. So there are resources. It is extremely frustrating not to know what's going on with your child, not to have a name for it, not to have a support group to go to. It can be extremely isolating. You feel like nobody understands what you've been through. And one of the large organizations that tries to mitigate that is the Genetic Alliance, which has been around for a number of years and grown in size. And they will take all comers with a name or not and help connect people to a wide range of resources. I strongly endorse the journalists becoming familiar with that organization.
So why don't you take us through your presentation?
Okay, Do I just share my screen?
Yes.
Okay, we've already gone over my career briefly, so I will skip to the next slide. I'll give you a little bit of just the factual the information about genetic counselors, and then we'll come back to the more meaningful conversation. So genetic counselors are trained with a master's degree, and it's an interesting profession because you have to have expertise in both genetics, so you have to be scientifically interested and oriented, and in counseling skills. So you also have to be psychologically oriented, so able to think through what your patients or clients are experiencing. I've never loved the word patient because sometimes we're talking with parents of affected children. Sometimes we're talking to people who are at risk and they're not patients. So I will vacillate between saying patients and clients. I like clients better. So this profession has existed, believe it or not, for 50 years in the United States, but it has always been a pretty small profession. In 2019, the Bureau of Labor and Statistics became interested in whether or not genetic counseling was keeping pace with the advances in genetics and genomics, and identified just over 5,000 genetic counselors in the United States. There are currently over 55 master's programs now, and it continues to grow. Much of that based on the projections of the Bureau of Labor and Statistics that this profession is going to need to expand tremendously. Our programs and our genetic counselors are accredited by the Council for Genetic Counseling, and that requires taking an exam that's pretty hefty in ensuring that you understand how genetics works. So the primary objectives of genetic counseling are to convey the subjective meaning of information. So in other words, information that is useful to the person that you're or family that you're working with. So providing a genetics lecture on what you understand about the condition is a far distance from communicating what this information you have to share may mean for the patient or the family that you're working with. And so it requires a lot of work that I'll go through in some detail. Genetic counseling has always adhered to this notion of taking a non-directive approach. And what that means is it fosters opportunities for patients to make informed choices rather than telling people what to do, or advising them what to do is a better way to state that. And I'll say that this originated primarily in the prenatal setting. So I should reiterate that genetic counselors work in prenatal, they work in adult genetics, and they work in pediatric genetics. They also now work in specialty clinics in cardiology and cancer settings and many others. So it has really expanded. But prenatal was one of the first settings. So in the early days, testing was offered for pregnant women who were interested. And I think there's pretty much ethical consensus that the opportunity to have a test to determine whether your baby is affected should not be followed by advice that you should terminate the pregnancy in any circumstance. So this has been an interesting perspective. It has continued throughout prenatal genetic counseling. The idea is to help people really understand what their choices are, what information they could learn, whether it would be useful to them, and to walk away if it's not something that they're interested in pursuing. And so the problem in genetic counseling is there was a lot of generalizing of non-directiveness, which this is my personal and professional opinion. It's hard to find evidence of this, but I think genetic counselors, they benefited from that approach because it focused them on respecting and understanding the patient's or client's needs and preferences on how they think about and work through genetic information and what it means for them and their family. And ideally, that's accomplished in a way that empowers the person, fosters autonomy, and evokes their competency. But it requires the counselor keeping the other person in their inner experiences at the front of their mind. And by that, I mean, you almost have to take yourself completely out of who you are, which is virtually impossible, but you have to get out of your own mind. What I have always done when I'm working clinically is when I go to open the door to visit with any sort of patient I'm going to see, I hold on to the handle and I say, this is a stranger. You've never met them. Make no assumptions. Forget your past clients before I go in. Of course, it's not magic. It doesn't help protect me from slinking into what's familiar and what I know, but I try really, really hard to meet every client as though they're a stranger, and I need to spend a lot of time learning who they are, what their preferences are, and what's important to them. So that's a counseling model of genetic counseling. There are two primary models that are practiced in genetic counseling, the counseling model and the teaching model. You'll quickly learn that I have a strong preference for the counseling model. I see a lot of concerns and issues with the teaching model. The counseling model makes assumptions about human behavior as it is understood through a psychological lens, and it integrates evidence-based approaches. So there's evidence for it being effective, and it aims for mutuality. In this case, the counselor is not an authority figure, but a partner in helping work through what's going on in the family. The teaching model makes assumptions about human behavior as though it's understood through an analytical lens. And by that, I mean it is more of an authoritative sort of approach where the genetic counselor says what they know about how something is inherited, what the chances are that it could happen again, what the risks are to other people in the family. Certainly, this information is part of genetic counseling, but in the teaching model, that's the primary focus. I'd like to tell you that the majority of people practice a counseling model, but erupting current research suggests that actually the teaching model is much more common, and I think has become understood as the sort of primary way that genetic counseling occurs. I'm going to focus on the counseling model because I think this is so much more important, and there are a lot of genetic counselors that follow this model. It's based on the perception that individuals seek out counseling for complex reasons. So yes, they're there for information. They want to be able to ask questions and get information. They want to enhance their understanding of what's going on for themselves, their child, or their family. They're seeking support. They're seeking validation for how they're feeling, which can be a wide range of emotions. And of course, everybody as a human being is seeking some reduction of anxiety, and the unknown can cause us a lot of stress. So just getting some answers to that can be helpful. And overall, parents and patients are their own best resource. So what genetic counseling and a counseling model is focused on is empowering them, which doesn't mean giving them something. It means helping them recognize what resources they already have to be able to do this, and is really, I think, the most important outcome of genetic counseling, which means there needs to be a lot less of the counselor in the interaction and a lot more from the patient. So the counseling model goals are to understand the client. What are his or her circumstances? What does he or she think about them, and how is he or she feeling about it? And again, what we want to do is promote a greater sense of control that begins by facilitating the opportunity for the client to have control over the genetic counseling session. So if I come in as an authoritative teacher in the teaching model and start talking at people, I am not taking advantage of who that person is, what they already know, what they've already done, what their resources are, and what their primary concerns are. So taking a back seat to get to know the client well is key to the genetic counseling model goals. So we want to help the client find solutions to specific problems. Because genetic counselors often don't have a lot of time to meet with people in busy clinics, it may involve several sessions. If a child is hospitalized, you might be fortunate enough to be able to see a counselor more than once. You can always schedule a second appointment for an outpatient genetic counselor, but it's hard to get all this stuff into one session. So sometimes there's follow-up over the telephone as well. But we want to help clients find solutions to the problems that they have. Again, this is the beginning of facilitating further empowerment. We want to reduce psychological distress. And the only way we can do that is if we can be somewhat in the head of the client and understand what they're going through at that particular time. And over time, what we're trying to do is to support and raise the person's self-esteem about their inherent ability to take care of things that feel like you could never possibly take care of them. We know from good psychology research over the years that human beings have a resilience that we don't know until it's really tested. And we can accommodate to things that we never thought we ever could. We would never predict we could. We have no evidence that we could. There is a lot of research showing how people can dig down and find their ability to manage the stressors and not only adapt over time, but actually in most cases over time feel that they have become a better person or had a better life as a result of their difficult experience. They've grown in a way that they did not anticipate. Sorry, my slides are jumping around a little bit. So genetic counselors who practice the counseling model ally with the client's concern. I hope I've made that clear. So this is a very canned statement, but just to give you an idea, you might start with something like, so you're facing some disturbing news, and I'd like to hear your thoughts and feelings so we can find a way forward. So what that's trying to introduce is that there's a focus on both thoughts and feelings, that you're partnering with the client, that you're not making assumptions other than you're familiar with the fact that they're facing something that's threatening. It has to be stated with genuine concern. I don't memorize this phrase and walk in and say it to my clients. I say something that comes to the top of my head and is earnest with every patient I see. This is not something you program, because then the authenticity of what you're saying disappears. And that's the entire point, is that you say what you mean. Genuineness is really an important part of establishing this relationship so that the client experiences it as presenting empathy. It also establishes a presence of being there to help the client through what may be a very difficult circumstance or decision. And in that case, it's what we might call a joining or a partnership. And the strength of the counseling model resides with dealing with personal and interpersonal issues. This comes from Seymour Kessler's book, Psyche and Helix. Seymour Kessler was a leader in the profession, and he was a psychologist. So his perspective leaned much more strongly towards the counseling model. And when research revealed that more of the ways that genetic counseling counselors are practicing as a teaching model, he wrote a lot comparing the two and putting forth the counseling model as much more important. So It requires a very deliberate effort by the genetic counselor that I've tried to outline. It's based on understanding another person and providing help and to work through life problems. It's accomplished in a way that empowers the person, fosters autonomy, and evokes their competency. And this does not mean that you have to be a highly educated person, that you have to have familiarity with the medical system. This is something that if you're a good genetic counselor, you can find a common ground with any patient that you see. It is hard work, but you can do it. It requires the counselor keeping the other person, I've already presented this, and their inner world in their mental foreground. So again, leaving your own issues, your own thoughts for the day, your own lifetime experiences at the door when you're meeting somebody else. It also requires, I'm saying the same thing, that the counselor suppresses one's own needs for the sake of someone else. So when a person with a rare disease encounters a genetic counselor, they form a partnership. The individual may ask for information he or she is seeking to understand. And if it's difficult to understand, may also ask for clarification. There's also an ask for support that's needed. And they may share their thoughts and feelings if they're feeling it's safe to do so. So this is a bit of the trap of genetic counseling. The assumptions that most patients or clients make is that the genetic counselor is going to give them information. They're going to tell them what the condition is, or they're going to tell them the mode of inheritance or the risk to family members. And they're not aware of this other opportunity to get support. Sorry, they're jumping again. Oops. So discussing thoughts and feelings can cause anxiety. So you have to make the client feel comfortable. You have to be genuine with them, because they're starting to talk about things that are that make them vulnerable. And when you engage and feel valued and respected, it can enhance the feelings of empowerment that we've been talking about. So within the partnership between the counselor and the patient or parent of a child with a rare disorder may feel less alone to learn others live with the same or a similar condition. Now, usually they don't want to hear that at the beginning of when a diagnosis is made, but over time, they very much may be looking for the comfort of touching base with other families who have had similar experiences. I'll get back to resources in a bit, but almost everybody who has a genetic condition or rare disease is dealing with uncertainties. They're rare, which means we don't understand everything that we would like to understand about all these conditions. And so counselors can literally help patients find ways to cope with the stress of those uncertainties. We've done some research in this area. And it's amazing how people over time learn to cope with the uncertainties. But because we know people are capable of that, even when the stressors are very high, we know that they can do that. And as a result, genetic counselors can come up with ways that they can help people do that for themselves, perhaps more quickly than it might happen naturally. So part of it is receiving validations about their thoughts and feelings. Uncertainty leaves you just grappling for where to land and what it means and how worried to be, and going through that, and then eventually meeting with people who have similar experiences can be very powerful for individuals dealing with rare disease. So some conditions, as you've already probably heard in this conference, are so rare that they exist, that there may be less than 50 known cases. In some cases, it may be the only case that somebody's ever seen, and the physician can't find anything in the literature that seems similar. This often means that it's hard for families, obviously, to know what to expect. If it's that rare, people haven't heard of it, And there is almost certainly likely not to be a treatment that's available. So over the years, affected adults and parents have established support and information groups for accessing what information is known about the condition, what researchers may be studying it. They often take their queries to the NIH, which studies rare diseases, and whether efforts are underway to treat the condition. Sometimes genetic counselors know of these rare disease groups and connect families. They should be able to find them readily. And to do that for families may not be ready. I'll put ready in quotes. It might not be the time they feel connecting with others would be useful to them, but they may change their mind. And it's still good to talk about what some of the benefits of connecting with others can be. These shared experiences over time lessen the feelings of isolation, and sometimes the shame or the hesitation to share what you're going through with others for fear of being judged. So just to give you a few examples of genetic counseling, this is one of the conundrums of my career. As I told you, I did not do a lot of work in prenatal genetic counseling, but I did some, the University of Michigan. And when parents went through prenatal testing and learned that their baby was affected with Down syndrome, they were always interested in learning more about what Down syndrome was. How do you describe the lived experience of a condition? You can read everything online or in the peer-reviewed literature. You still don't have much of a very good sense of what the lived experience is like. And the life expectancy and lived experience of people with Down syndrome has improved exponentially over the last couple of decades. And so if you read something dated, you get a very different experience than what's currently accurate. So it's a big adjustment for people. They were expecting to have a baby without a condition. They do have the option to terminate the pregnancy, although obviously, and I won't waste our time on this topic, less so under the current abortion restrictions. The genetic counselors are still figuring out what the limitations are. And parents may only vaguely know about Down syndrome. They may think it's a tragic diagnosis if they have sort of out-of-date information. And so, and in a couple of the places I worked, we worked with the Down syndrome organization, and we made parents, we gave the opportunity to parents to meet with parents of children with Down syndrome at various ages. And that helped them learn things about the disorder. But we actually had also experienced a sort of unexpected outcome, which is really psychologically fascinating. And we stopped this practice. And that was that the pregnant couple would meet with the families, get their questions answered. And then when we would follow up with them about what they were thinking about the way forward with the pregnancy, a number of these parents said that was very helpful. They're doing an amazing job with their child, and the child seems to be doing well, but there's no way that we have the strength and abilities that those parents do. Just think about that for a minute. I mean, that is just profound, because of course, none of those parents thought that they had those strengths or abilities. They discovered them as a result of raising their child with Down syndrome. I'm not saying they made the wrong decision. It might have been the right decision for them to terminate the pregnancy, but they're not able to interpret the success of other parents working with their child because they can't imagine that they would be capable of doing the same thing. That makes the work really challenging. So I would just like to say that there are many, many gifts of genetic counseling, and this is a very sort of personal interpretation, which is it's impossible to explain the gift of learning about the experiences with rare conditions. It's so profound and broad and different across the disorders. There's no way to say it simply. As a genetic counselor, to learn to empathize with challenges that people are undergoing without ever being able to fully understand, because I'm, of course, not in the situation that they are. And assuming that you can understand it means you're really missing the boat. The other thing is that people do find that they are able to manage things and do things and find strengths and connections that they never thought possible. And this is a really interesting aspect of what it means to be human. We don't know until these challenges are put in front of us. And in addition, we make very meaningful and very intimate connections with those who are making life-altering personal decisions. We as humans don't get that opportunity very often, and it's an incredible privilege. Yes, it's hard. Yes, cases haunt me. Yes, I feel terribly sad sometimes as a result, but overall, people have come through in ways that would have been impossible for me to predict early in my career. And to care for people deeply who do not define themselves by their conditions, again, is just an unbelievable privilege and orientation about what it means to be vulnerable and what it means to be human. So I'll just talk briefly about approaches for interviews with individuals. This makes me a little nervous because journalists know more about this than I do. But I think it's important to talk with several people when you're interested in a particular condition or a particular aspect of rare disease, so that you get the broad range of experiences and you don't base it on one person unless you're doing a particular story about a person. Obviously, convey your respect for who you interview by reading about the condition prior and recognizing it's the person's expertise and lived experience you hope to convey, beginning with something positive that you earnestly admire from what you read. I've talked about the genetic support groups, but I think if you're genuine and considerate, most people will be eager to share with you because they feel isolated and misunderstood. Again, I feel embarrassed saying this to journalists. Ask for permission to ask your questions, state your intentions, learn whether there are questions the person prefers not to answer. Is there any limits to the interview? It's good to know that early on. Convey your genuine respect and appreciation. Attend to the person's affect. If you see that they're getting uncomfortable or upset, obviously you want to stop and sort of check in. And make sure you remind the person that they don't have to answer any question they prefer not to. Convey your gratitude and offer the opportunity for the person to see what you write before publication. And I know not all journalists are in a position to do that or prefer to do that, but I would encourage you to. I think I've already mentioned these resources, so we can wind up here. I will echo what you heard before my talk. There is a book called The Boy in the Moon, written by Ian Brown, who is also a writer, a journalist, that is incredibly moving about his experience with his son with a rare disease.
Thank you so much for that presentation. I'm looking at our Q&A in the chat. Sasheen, are you there? And can you introduce yourself to Barb and ask your question?
This is Xiaoqun. I'm a journalist. I'm a health journalist from Malaysia. And, we have universal health coverage, but our public health system is so crowded that, counselors, psychiatrists, anyone who works within the field of therapy has very little time to actually talk to people. So I totally understand that the counseling method would seem to be the best going forward, but how do you deal with the lack of time in being able to establish a connection in order to make that successful?
Yeah, that's a very, very good question. I think when you're short on time, which does happen in the US too. We have lots of privileges in our lack of medical system, but in our medical resources. But a lot of the clinics are busy and full, and counselors don't have as much time as they want. So it has to be short and effective. And that is a big challenge. I think you minimize the information and you focus more on what the patient's concerns are. Because if you spend all your time saying there's all these different tests you could have, blah, 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 and here's what you could learn, you've learned nothing about your client. So for me, the balance would be toward what's important to the client, what's a high priority for them making a decision or finding a resource, and focus on that.
In many countries, there are genetic counseling companies that make pseudoscientific claims about what the DNA can tell people. There are also often no effective regulations to safeguard customers' genetic data. How do journalists report on these aspects of counseling without scaring people away from the good that it can do?
I don't put genetic counseling in the same category as testing laboratories and what's going on with genetic information. But your point is, I think, that somebody could come to you with information they got from a lab that wasn't accurate, right? So that's the science part of genetic counseling that I didn't spend as much time talking about, which genetic counselors have to have the expertise to be able to know if it's a valid result, know the reputation of the laboratory, and in many cases, the genetic counselors will interpret it themselves before they return it to a client. So the authenticity of a genetic result is essential to doing an appropriate and ethical job with a client. That can be hard to do.
One of our speakers for tomorrow, actually, our panelist has a question. Christine Mutena, are you there, Christine?
Hi, yes, I'm here. Can you hear me?
Yes, we can.
Yeah, hi. I just wanted to find out, like in Kenya, we don't have a genetic counselor. We just have one ped and one adult geneticist. So when it comes to genetic counseling, what would you advise, like because I represent a patient organization, how would you advise me to help my members on genetic counseling and the importance of it, because it looks like I'm selling a service that is not available in the country.
Right. So the best resource for you is the physicians who practice genetics. And it might be possible to get a group together to work with, visit the physicians and work with them about the major questions that families have and that they need some time to talk with them about those issues in addition to the physical exam and other information. The problem is if the physicians are already overworked and exhausted, it would be difficult for them to add that to their practice. But a number of clinical geneticists in the US and Canada and Europe do some counseling themselves. So it isn't all master's level counselors, but some physicians care for their patients as well. So for people who really need to talk about something life-threatening or very difficult to deal with, or need help on how to manage things going forward, the physicians should be able to do that if they can find the time. That's the only resource I can think of.
Okay, sorry, let me add something else. And I know like there are a couple of Kenyan journalists on here. It would be good to also report on how important it is to get genetic counseling, because I find that we are not there yet as a country mentally to accept that this can be done, or this is the best way forward, genetics, finding out what is wrong with my end of the family, because stigma is very real in the sides of the continent.
Yes, and interestingly enough, I know it's a very different environment, but South Africa has had genetic counseling training and genetic counselors for many years. And I don't know if that's of any help to back your effort, but genetic counseling is spreading across the world. It's been in India for many years now. There's many genetic counselors in Australia and across Europe and most developed countries. And so, yes, I strongly endorse you saying this is a important need going forward.
Well, I think we can take one more question, and that is from Eric Peterson. Are you there? Apparently not. Let me read this, and I don't know if this is in your field of expertise, but with whole genome sequencing clinical grade, how do you deal with the variants of unknown significance? Should they be filtered out in the final physician report, or just put as an addendum to the report?
Great question. One of the conundrums of genetics of today, people handle it differently in the US. Some companies don't even report their VUSs on the sequencing report, and others feel that you need to, because those variants of unknown significance can over time be interpreted actually. So more of them report them than not. And then individual providers decide whether or not they're going to share that information with the client. If they give the client the printout, the client may ask questions if they're savvy and they read it carefully, that there are VUSs on it. But that's still a growing debate, and there's no consistent practice.
I said that was the last question, but there is one quick one that I'm curious about. Is there a proper ratio of patients to counselors? In other words, should one counselor spend a lot of time with one? Talk about that.
Yeah, the report from the Bureau of Labor and Statistics was that there are far too few genetic counselors, especially with the explosion in genomics. So that saw a huge, almost a doubling of the number of training programs. But no, there's nowhere near enough to do all this. I think over time, genomics is going to move out into mainstream medicine, and physicians, nurses, and social workers will be involved in this work. And I think that's a great thing. This is going to be part of medicine, but we won't have the specialty training that we do right now in the same way. So we'll have to figure out how genetic counselors care for people who are really struggling with rare disease and issues, and those who just need help interpreting, I shouldn't say just, but need help interpreting their genetic test results so they know what medical follow-up they need. So there's different levels of need for the counseling part.
I am so grateful that we have access to your slides, because there was so much information that I found useful to me in thinking about the role of counseling in this process. And so we are so grateful that you took the time out of your schedule to come and join us and talk about this. And I hope that we can stay in touch with you, and we'll certainly share.
Absolutely. I will add that you're asking me to talk about my favorite topics, so it was not a big ask.
Wasn't a big lift. So if you get an email from one of us, we won't be bugging you either. You'll
No,
take it.
not at all.
Wonderful. Thank you so
I
much.
was thrilled to do it. Thank you for the invitation.
Thank you, Barbara Biesecker. Take care.
Take care.